Hello everybody, my name is Julian Luetkens. I'm a professor of radiology at the University Hospital in Bonn in Germany, and as an academic center we do a lot of imaging studies over here, especially in our MRI department, and we do a lot of oncological imaging, cardiac imaging and also MSK imaging. And we have a strong and trustful research cooperation with Philips for decades almost. And over the last couple of years, we evaluated a new reconstruction pipeline, SmartSpeed Precise, in clinical routine. And this reconstruction pipeline gives you new possibilities to accelerate your MRI acquisition. And this techniques, it places two convolutional neural networks in serial. And the first network, it's an adaptive CS-net. It makes an image denoising within your reconstruction pipeline. And the second network, it's a precise image net. It upscales your resolution and leads to sharper images. And so this is the power of a dual AI in one reconstruction framework. And what you can do then in your clinical routine, you can even acquire more beautiful images. So if you have your normal acquisition, it's compressed space, you can turn SmartSpeed Precise on and you get even more crisp and beautiful images, but within the same acquisition time. But you can also use SmartSpeed Precise to increase your acquisition speed. And for example, you can choose a higher acceleration factor within compressed sense. And this normally gives you a penalty of a noisy image, yeah? And because you use the larger acceleration factor, and if you now turn SmartSpeed Precise on, you get a beautiful denoised image with almost the same image quality than if you would have chosen a lower acceleration factor. But if you want to even more accelerate your image acquisition, you can also lower your spatial resolution of your acquisition, and then you are even more faster because you have to acquire less K-space data. And with SmartSpeed Precise, you can then use the resolution upscaling to get to your original resolution, like if you haven't reduced your spatial resolution. And in the literature, this effect, it's called super resolution, and together with Philips, we published several studies on this topic, and we used SmartSpeed Precise to enhance the capabilities of MRI, for example, in breast MRI, prostate MRI, and cardiac MRI. And in one publication, for example, in breast MRI, if we use SmartSpeed Precise and use the capabilities of resolution upscaling, we were up to 50% faster with our acquisitions. And in prostate MRI, we applied this technique on T2-weighted images, and in these cases we were up to 36% faster. And this is really astonishing because you're not only faster within these publications with the image acquisition, but you also get better images compared to your original acquisition, which was based on also on compressed sense. And this is maybe because if you acquire your data in less time, then there's also a lower chance that, for example, like movements or small ball movements degrade your image quality. SmartSpeed Precise not only enhances your capabilities to do faster images, but it's especially available in investigations which last a long time. For example, cardiac MRI. And if you, for example, have a difficult patient within your department who can't hold his breath, for example, or who has arrhythmia, you typically get a degraded image quality with your segmented cardiac sequences, and you often have to repeat your imaging, and then the examination lasts a very long time. And typically what you can do in this clinical scenario, you can employ single-shot sequences, which can acquire your case-based data within a single heartbeat. So it's also called like a single heartbeat protocol. And this kind of sequences in the past, it was associated with a huge penalty, and the penalty is that if you acquire your data very, very fast, that you have low spatial and also a low temporal resolution within your images. But we use SmartSpeed Precise now in such single-shot sequences, and especially in difficult patients, we can acquire now single-shot sequences, and we enhance the image quality of such sequences with the resolution upscaling and also the denoising, and we get beautiful images out of these complicated patients. And we were also able to reduce the examination time for a cardiac MRI from 60 minutes to almost 20 minutes. So this is a huge increase in diagnostic and performance within our department. And SmartSpeed Precise also allows you to discover new possibilities with MRI images. For example, if you really need a high spatial and temporal resolution within your images, with SmartSpeed Precise we can also do right now fetal cardiac MRI more accessible in clinical routine, because these are the images where they are very detailed, where you need all the denoising and sharpening capabilities of these algorithms. So we were able to achieve new frontiers in MRI. And so these are all the possibilities you can have with SmartSpeed Precise, and gives you better images if you want it. And you have also the possibility to even accelerate your MRI protocols up to 50%. And and this is nowadays, I would say it's a game changer if you have a radiology department, because there's an increasing demand for imaging studies, and MRI is the true bottleneck of radiology department. And with SmartSpeed Precise you can scan more patient, more efficient within less time.